May I request now Dr. TITIYAL to come over and talk to us about role of monofocal plus for expanded patient groups. I think again Dr. TITIYAL is one of the pioneers in cataract surgery and has led with distinction the RP Center for several years and now is entering a new era of growth, and I'm sure he'll continue to leave his mark. Over to you, Dr. TITIYAL.
Thank you so much, Dr. Ramamurthy, and good afternoon, friends. I think we had a terrific condition IOLs, and we also have a significant confidence, experience of these enhanced lenses for so many years, no financial disclosure. And these points have been highlighted by both Dr. D. Ramamurthy and Dr. Mahipal Sachdev, the advantage of this monofocal plus lens, where we're looking for a functional vision for advantage of people who are undergoing surgeries, and looking into a profile lens, which Dr. Mahipal beautifully summarized, and this is what Dr. D. Ramamurthy talked about, the various literature on enhanced lenses. Effectively, this tells you that if you look at the defocus curve, this is Technics versus Technique enhanced. You can see nice defocus curve ranging from minus 0.5 to 1.5 diopters, and that gives you advantage of intermediate vision, which Dr. Mahipal was talking about. If you summarize the entire studies in the literature, almost 85% patient will achieve 20/25 vision intermediate, and 30 to 40% will have with a standard monofocal. See the difference between 30-40% to 85%, and better functional vision without the compromised quality. That is the idea of giving intraocular lenses to our patients. No visual photooptic phenomena which can be disturbing or disrupting to their function, and uncorrected near visual acuity is also better, almost 1 to 2 line better than a monofocal lenses for these patients. So therefore, if you see the last line, higher patient satisfaction, which we are looking for, with the spectacle independence most of the time for these lenses also. With the experience of enhanced lens for so many patients now, we thought why not to look into a special situation, which normally we'll say if you shift from the conventional monofocal lens, they'll say don't do it, don't implant in the cases where it is compromised, like diabetic retinopathies, glaucoma patients, or patient who is going to have significant problems subsequently. So we have patients of diabetic disorder, glaucoma, post-refractive surgery, dense cataract where you can't actually assess the retinal macula in these patients. What about using these lenses to expand your patient experience with these lenses for future directions also? Ultimately, we are looking for a functional upgrade of patient after going surgeries. So these are few studies which are available on comorbidity features. This is one study where they've used enhanced lens along with a vitrectomy in vitreous hemorrhage patients, and they showed that very good intermediate vision in these cases also. Other way around is you're looking for a glaucoma patients, it also does not decrease the contrast in these patients also. We designed this IIT and investigator-initiated study with J&J. In last 6 months, we have recruited many patients, but our criteria was to have binocular surgery to be done within a month, and patients should have a diabetic retinopathy without any maculopathy or proliferative disorder, and bilateral phacoemulsification with enhanced implantation are done in these cases. The study aimed for to look for visual outcomes of this enhanced monofocal lens in diabetic retinopathy patients. We looked for a visual acuity as a primary outcome, uncorrected distance, uncorrected intermediate and near vision, binocularity, and look for optical quality matrix, that is MTF, contrast sensitivity, color vision, stereo acuity for these patients, and also most importantly look for a patient satisfaction and look for a photic phenomena in these patients also. In result-wise, in these 24 eyes, you can see here almost 82% of cases achieved uncorrected intermediate vision at 66 centimeter or 20 and 40, and 36% achieved N8 or better vision at 33. If you take this as a 40 centimeter, maybe this percentage will further increase. There's a wonderful results. All patients improved from the pre-surgery to post-surgery in terms of uncorrected acuities in all distances. The second important thing for a binocular surgery is to look for binocular function. And the best way to assess is a stereo acuity for near and distance for these patients. And we found that the stereo acuity for distance and stereo acuity for near were as good as monofocal lenses, or they are comparable to a standard age group patient as such. In terms of MTF, you look into MTF right from the from smaller range to a higher range, you could see better MTF in enhanced lenses compared to preoperative conditions. But in fact, if you look into a diabetic patient where you think contrast will be poorer, but these patients did pretty well in terms of increased MTF in these patients also. Contrast sensitivity, which is again one of the important criteria for all pseudophakic patients. We had a significant improvement in all special frequencies. Poster values are within the, sometimes even better than the normative data seen in individuals with the same age group, and excellent contrast sensitivity at lower frequencies also, which is supposed to be compromised in diabetic retinopathy patients. Visual quality indicators like Stell's ratio and higher order aberration, again, there was significant improvement in both of them from pre to post surgery. And color vision wise, which is another important area to be assessed after a techniques design or as models, where we look for improved contrast in these cases by not hampering the chromatic aberration for these patients also. If you look into values wise, post-op color vision scores were within normal limits as age group, indicating that it preserves the chromatic aberration or discrimination from patient suffering from a diabetic retinopathy per se. I think this is one of the most important slide which came from our patients. If you see here, almost 95% did not report any difficulty for near, intermediate, and distant vision tasks. Around 80% of cases were totally independent from the spectacles, which is a very high number. Only 20% of patients require a near addition, that too in a reading of very fine prints. And if you look at other area also, the glare and halos were less than 6% of patients. And this is to a direct questioning to them. If you ask them, they might say, yes, yes, I see. Otherwise, they don't complain at all. Therefore, high functional independence and low photic disturbance is the outcome for this study, and which goes with the enhanced IOL per se also. So if we look into our interim results for these 24 eyes, uncorrected distant visual acuity, uncorrected near visual acuity improved by 4 to 5 lines from this pre to post, and equally for near vision also. And almost more than 82% of cases achieved good vision for intermediate and distance per se. Quality-wise, all these patients had a very nice visual quality, good stereo acuity for distance and near, good contrast sensitivity, preserved color vision, and minimal photic symptoms. That is what we are looking for with enhanced good distance near vision, effective contrast transfer, color vision comparable to normal population, high spectacle independence, even for near, distance, and intermediate, and definitely delivers a strong functional outcome in these patients of diabetic retinopathy also. So we can rightly summarize, techniques enhance IOLs offers a safe functional upgrade in diabetic retinopathy patients, which are normally we exclude from your routine indication for these lenses. Effectively look into a contrast, chromatic aberration, color vision, they are all preserved in these patients, very well tolerated. These group of patients. We do have some glaucoma patients also enrolled in these studies, and with the results will come subsequently. Dr. Sridevi Nair, who is sitting here, going to continue this study for another 1 or 2 years. Thank you.